you can find one big fossa. It is called acetabulum. This fossa important to form hip joint. Which structures can be seen in this fossa? First of all, if you look inside of this fossa, you can find this lunate shape structure, surface, which is very smooth. It is called facies lunata. It participates in formation of the joint. Next part, this one in the center, is irregular in structure, not smooth. It is called fossa acetabuli. And fossa acetabuli continues into incisura acetabuli. So this is structure of acetabulum. Now how to show three parts of this bone. You have to take a pointer, put it in the center of the acetabulum, hold hip bone that its wider part faces upward, and then from this midpoint of acetabulum you have to draw imaginal horizontal line, like that. Then this line passes through this elevation and go in this direction in that manner that this deep notch must be above this line and come back to the center. So this imaginal horizontal line separates first part, which lies above this line. It is called os ilium, iliac bone. Then that's why lower part is subdivided into two bones. How to show borderline between them? Once again, I put my pointer in the center of acetabulum, hold it that this wider part face upward, and then I have to draw imaginal vertical line, not horizontal, like that, and come back approximately to the center of acetabulum, but from the contralateral side. So, and this line separates first part, which is anterior, is called pubic bone, which is smaller, and which is thicker is os ischium. So there are three bones. After the puberty, these three bones fuse together, same like sacral vertebrae, and one single hip bone is formed. Now, separately every part, every bone. First one is, as I already said, is ilium. Ilium consists of two parts. First part, narrow, this one, which is very close to the acetabulum, or I took it. This part is called body, corpus ossis ili. Next, wide part is called ala ossis ili, wing. Ala ossis ili terminates by long crista iliaca, iliac crest, but this iliac crest terminates anteriorly and posteriorly by protrusion, this one and this one another. This protrusion, which faces forward, is called spina iliaca superior anterior, superior anterior iliac spine. Logically, this one is called spina iliaca posterior superior. It's logically, if you find anterior iliac spine, logically posterior must be. If you find anterior superior iliac spine, that's why anterior inferior iliac spine also must be. It lies a little bit below. And correspondingly here, spina iliaca posterior superior is here. It is termination of crista iliaca. But this one, spina iliaca posterior inferior. Just below this spina iliaca posterior inferior is deep notch, which is called incisura ischiatica major sciatic notch. Well, this ala ossis ili is white plate, bony plate, and it has two surfaces. First surface faces inside medially, and it is usually concave. It is called facies interna or facies pelvica, because it faces into the pelvis, pelvic cavity. This one, facies externa. Facies externa contains three lines, 1, 2, and here is 3 lines for gluteus muscles attachment. So these lines are called linea glutea, superior, inferior, posterior. On the pelvic surface, as already said, it has concave surface, and this big concavity is called fossa iliaca, which contains iliac muscle. Behind this fossa is irregular structure, and here we can find two parts, two structures. First one is not clearly visible because bone is broken. This one is called facies auricularis, same surface, facies auricularis is present in the sacrum, and they unite together to form iliosacral joint. And rest part is called tuberositas iliaca for ligaments attachment. Borderline between this irregular part and fossa iliaca is this line, which continues downward, and it is called linea arcuata. Arcuate line because it has concavity and looks like arch. That is all. There is all structure of ilium. Next one, pubis. Pubis consists of three parts. First part, which is here, is called body, corpus ossis pubis. And from the body, two rami starts, 1 and 2. One rami goes backward and laterally, like that. It is called ramus superior. But another branch goes downward, is called ramus inferior. On the body, we can find fascia symphysialis, symphysial surface, which is necessary to make connection with contralateral bone, to make pubic symphysis. Then, approximately 1 to 2 centimeters away from the fascia symphysialis is protrusion, which is called pubic tubercle, tuberculum pubicum. On this bone it is broken because the bone is cut. Then also on the superior branch, superior ramus, we can find borderline between ilium and pubis. And this borderline looks like elevation. That's why it is called, this elevation is called eminentia iliopubica, because it lies on the borderline between ilium and pubis. Linea arcuata, which passes on the pelvic surface of the ala ossis ilii, when it reaches this eminence, eminentia arcuata, then it has direct continuation along the superior ramus of the pubic bone. And its continuation is called pecten ossis pubis. Pecten means crest. So on the ilium it's line, but after this eminence it's crest. But it is not called crista, it is called pecten. I put your attention to this. Well, next bone is ischium. Ischium consists of two parts. First part is vertical, which starts from the acetabulum and goes downward, and it is called body. And second part is horizontal, which goes towards the inferior ramus of pubic bone. It is called ramus ossis ischii. Two rami, ramus ossis ischii and ramus, inferior ramus of pubic bone, unite together here, and we can see junction between them. On the borderline between horizontal ramus and vertical body is very big tuberosity, tuber. It is called tuber ischiadicum, ischiadic tuber. On the posterior surface of the body of ischial bone, there are two structures. One of them is this protrusion. It is also broken here, but clearly visible on this bone, this one. It is called spina ischiadica, and below this spina is incisura ischiadica minor. So that's why on the posterior surface of the bone there are three ischiadic structures. First one is spina ischiadica, which is between two notches. One notch is incisura ischiadica major, which belongs to the ilium, and another incisura ischiadica minor, which is belong to the ischium. Please remember this. And spina ischiadica itself also is part of ischium. When all three bones unite together, they form big foramen, which is called foramen obturatorium. And on its upper margin, means on inferior surface of the superior branch, superior ramus of the ilium, of the pubic bone, is groove, which is called sulcus obturatum. That is all. This is all structure of the hip bone. How to identify right or left? Wide ala ossis ilii faces upward, superiorly. Then the biggest fossa, means acetabulum, faces to the lateral side, and big tuber ischiadicum lies on the posterior aspect of the bone. That's why this bone is right. Understood? Yes. Questions? No. No questions.